Good day, everyone. Now we are down to our second topic in HIS, which is the HMIS M&E or Monitoring and Evaluation. So this will be our learning outcomes for today. Explain the purpose, framework, and plan of an HMIS monitoring and evaluation system. Describe the relationship of your M&E with the HMIS indicators. Determine the 5 broad categories of HMIS indicators. And lastly, establish the relationship of HMIS indicators with health programs. Now, you need to remember that your HMIS is specifically designed to assist in the management and planning of health programs. So, it is not about the delivery of care. Okay? It is opposed to delivery of care kasi kung mingon kag delivery of care, that is HIS or Health Information System. So we are talking about HMIS or Health Management Information System. Alright. So the M&E is a core component of current efforts to scale up for better health. Thus, continuous monitoring and evaluation is necessary for it to be effective. So, hindi ibig sabihin na tapos na kayo nag-implement ng program, wala na. Okay? So, paunsa ninyo mahibalaan kung katong health program na gihatag ninyo is effective. Diba? So, by definition and function, monitoring and evaluation they are complementary. Okay? So, ibig sabihin, you cannot do monitoring without evaluation and vice versa. You cannot do evaluation without monitoring. So, your HMIS M&E aims primarily at assisting, okay? Nag-help lang yun na sila in the planning and management of national health strategy plans or health programs. Okay? So, monitoring, kung basahin natin, it refers to collection, analysis, and use of information. So, ibig sabihin, it is all about the whole process from start to finish. Okay? So, lahat ng mga nag-gather ninyo from start to finish from those programs, meron yan silang purpose. What purpose? For the purpose of learning from your acquired experiences. Okay? So, these purposes correspond to 3 functions. Okay? So, natay purpose of learning. Tatlong functions yan. We have the learning function, monitoring function, and steering function. So, when we say learning, di ba, kanang murag, okay, lesson learned. So, this is a knowledge acquired through experience, study, or you are being taught. Di ba? Gitudluan ka. Learning. Mo nang naa ka sa school. Monitoring, you are able to observe, no? Nakita nimo ay mali ni siya. No? You can check or under surveillance, no, gina-monitor nimo for a period of time. Steering naman, guide or control movement. Steering, di ba? Kanang mura ka drive. So, naga-control. Next, for evaluation naman, this is a systematic assessment of completed programs or policies. Take note of the word completed. Diba? Diba? Unsa day na ka na, for example, na amoy giapilan na seminar or symposium. Diba? At the end of that seminar or symposium, nagyud na evaluation. Kasi gusto ng speaker or ng committee if unsay mga kulang. No? Para puhon-puhon kung naan na po'y seminar na pud na i-conduct, kabalo na sila unsay himuon. Alright? So, mo na ang purpose sa inyo ang evaluation. So, the objective in short, no, ng ating evaluation, ang goal ng ating evaluation is to gauge the effectiveness of the program. So, diri ninyo makita sa evaluation kung effective ba inyong health program. Kasi kung hindi, you can make adjustments in areas that need improvement. Okay? If na ay function ang inyong monitoring, meron ding function ang inyong evaluation. We have learning function and monitoring function. Same pa rin. Learning function, lahat ng mga lessons na na-learn ninyo, need yan siya i-incorporate into your future proposals. Sa ato ang human resources, okay na di ay mga tulo ka speakers, dili na ta maglima ka speakers, kaya ang money or ang fund na na-allot dara ibutang na lang nato sa lahi ng mga bagay. Okay? So, na may na-learn dito. Monitoring function. Concerned parties review the implementation of policy based on the objectives and resources. So, the purpose of your M&E, it is a robust monitoring and evaluation system. It is really required to assess the effect of an integrated service delivery. Kung may robust, that is strong, sturdy, di ba? Tough, powerful. So, maski kung sa pa ng mga synonyms dara. So, appropriate indicators, data collection systems, and data analysis, they are needed to support decision making. No, they help guide the successful implementation of integrated services and measure the effect on both service delivery and use of services. So, appropriate indicators, examples natin dito, your inputs, process, and outputs. Data collection systems, we have the different softwares like your electronic health record, your personal health record, your PACS, HIE, data analysis. It's all about statistical tools, visual aids. O example nito, visual aid. This is an example of a pie chart. Okay? So, ito lahat, di ba, discuss na natin ito. Ano ganito sila? These are the components of your HIS according to HMN or the Health Metrics Network. Okay. Next tayo. So your M&E framework, this is developed by global partners and countries for health system strengthening, HSS. So health system strengthening, it is a term used in global health that roughly means to improve the healthcare system of a country. So, improve ang healthcare system sa isang country. Okay? Health system strengthening. Yung M&E framework ninyo, it is derived from Paris Declaration on Aid Harmonization and Effectiveness and from IHP or the International Health Partnership. So the Paris Declaration establishes targets that countries committed to achieve by 2010. While itong IHP or International Health Partnership, this is a group of partners committed to improving the health of citizens in developing countries. Sa meaning anong developing countries? That is, sa madaling salita, third world country. So, according sa akong na-learn sa IELTS, no, dapat hindi ka magamit ng word na third world country because it is somehow degrading, di ba? Kasi marang ginarank mo yung mga country. So, mas okay talaga na ang gamitin mo is the word developing country. Okay? So, kung may kag-developing country, mo itong mga country na medyo naglisod pa. Okay? Developing pa sila. dili sila katong mga na-achieve na gyud ang highest attainment sa ilahang lugar. Okay, so this framework places health strategy and related M&E processes of each country at the center. So lahi-lahi 'di ba ang pangangailangan ng kada country. So itong mga strategies, they are tailor-made to address health problems of each country. Kung mingon ka tailor-made, 'di ba? Kung for example, nagpatahi ka og sanina. So the measurement imong sanina is angkop or exact measurement sa imong body. Same ra gyapon ana, 'di ba? So tailor-made strategies para ra gyud na ana na country. So for example, ang Philippines na siya'y lahi na health problems or lahi ilang priorities than others. So, yun. The 4 components of your M&E framework, according to World Health Organization, are indicator domains, data collection, analysis and synthesis, and communication use. So, indicators must be tracked to determine the strengths and weaknesses of implementation. So, di ba, again, kung may kag-indicators sila tong determinants. Okay? So, mura na siya determinants of health. So, makita nimo kanina population based on their practices kung mabutang ba na healthy ba ni sila na population or unhealthy sila. Okay? So, yan sila, yung mga indicators, gagamitin kasi yan, no, as tracking. And, pwede din yan siya magamit for troubleshooting sa system. Troubleshooting, kung may problem, you need to provide solutions. Okay. So, your M&E plan, no, when you are creating a health program, you really need to determine how you are going to monitor and evaluate it. So, dili basta-basta lang na yung say tawag na naka-health program, no, nakabutang na dito tanan, budget, human resources, materials needed. But after that, paano ninyo makita lagi kung effective ang inyong health program? So, in short, you need to sit down with your team, no, and discuss regularly what could be improved with the health program. So, having this plan, no, having the M&E plan addresses na meron ka ng template, no, meron ka ng step-by-step guide para sa mga policy makers and health leaders, and in case, no, pwede sila mag-refer dito So, you have your M&E and HMIS indicators. So, an indicator is a variable which measures the value of the change in units that can be compared to past and future. So, variable, so meaning it is, element or quantifiable characteristics. So, in numerical value siya. So, ito sila lahat, no, kaning indicators ninyo, researchers can use that as supporting evidence to describe the health of a population. So, your HMIS uses indicators to monitor key aspects of health system performance. So, di ba, again, sa inyong health determinants or health indicators, kasali po doon yung morbidity and mortality rate. On how to compute the mortality or the rate of death in a population, kung saan to siya, di ba, death divided by population times 100 para maging whole number ang imuhang answer. So, for example, there is one person in a town of 100 people died from a plague. The mortality rate of the plague is 1 out of 100. So, it is 1%. So, again, review na lang to siya sa inyong BE or sa inyong biostat. So, let's proceed to the categories of HMIS key indicators. So, the USAID classifies these indicators into 5 broad categories. 5, okay? 5 broad categories about reproductive health, immunization, disease prevention and control, resource utilization, and data quality. So this table shows each broad category and ano yung mga key indicators. And each category, meron po siyang key indicator. So, under reproductive health, it's all about family planning, acceptance rate, antenatal care coverage. Kung mingon kag antenatal, that means before birth, okay? Before birth. So, it is care of pregnant women, okay? Kanang mag-ato sila, magpa-ultrasound, okay? Before birth, before sila manganak. Proportion of deliveries, no, pagpaanak attended by skilled health personnel, proportion of deliveries attended by health extension workers. Under immunization naman, we have the DPT or pentavalent 3. Okay? So when we say pentavalent, it is also called 5-in-1 vaccine. So it is a combination vaccine with 5 individual vaccines conjugated into one. So DPT is a class of combination vaccines of three infectious diseases in humans, which are the diphtheria, pertussis, and tetanus. Okay? And another one under your immunization is the measles immunization coverage. Under disease prevention and control, the fatality rate of malaria case sa mga bata under 5 years of age. New malaria cases per 1,000 population. New pneumonia cases among children under 5 years old na pod. TB case or tuberculosis case detection rate. So this is the rate na kung magpa-test ang isa ka tao, if maaba siya TB, ma-detect dayon. So nganong need man gyud ma-detect no ang TB or ang tuberculosis? Of course, para ma-cure, no, para matambalan. So morning diri na pud mosulod ang ato ang tuberculosis cure rate. Another one, clients receiving voluntary counseling and testing services. So perfect example po nito, no, kaya ang required ang counseling is HIV testing. So meron po talagang pre-counseling and post-counseling if magpa-test og HIV. So nga no, pre-counseling for the purpose na naana sila i-fill out na mga forms, and at the same time need og consent, no, na voluntarily magpa-test jud sila. And need po i-explain dito kung for example mag-reactive ang ilahang sample or ilahang blood, is they need to undergo confirmatory testing. And kung mag-positive gyud, this is the time na mag-post counseling para maingon no sa isa ka counselor kung asa sila mo ato na treatment hubs. Okay, asa sila pwede magpatambal. Now there is no cure to HIV, but merong tambal, no? This is what we call the antiretroviral therapy. Tambal siya, pang-manage lang, okay, sa symptoms. Kasi again, ang mechanism ng HIV ninyo, ginapababa ang immune system. Okay? So, maunang usually, ang mga patients with HIV, dito gid sila madali or mamatay sa mga infectious diseases kasi nga baba ang kanilang immune system. So your antiretroviral therapy, ang mechanism niya lang is to manage, okay, para to the point na parang magbaba ang viral load ng isang patient. Another one, prevention of mother to child transmission or vertical transmission, or what we called the PMTCT, prevention of mother to child transmission, treatment completion rate. Okay. Next, resource utilization. Okay? So, mga resources natin, paano natin ginagamit. Trace drug availability, outpatient department attendance per capita, inpatient admission rate, and average length of stay sa mga inpatient, no? Like 3 days lang ba sila dito na-admit, tag 1 week ba? Bed occupancy rate. So, ang hospital kasi, specific yung beds nila. Like, for example, a 200 capacity or 200 bed capacity na hospital. So, if you are going to compute for the bed occupancy rate, sige, dito na lang tayo. For example, 280 bed capacity hospital. If 200 patients nag-occupy dito sa 280 bed capacity hospital, then what is the bed occupancy rate? So, inyo lang na siyang i-divide. So, 200 divided by 280 times 100, the answer now is 71.4% yung rate natin. Data quality, reporting completeness rate, and reporting timeliness rate. So, for example, no, sa isa ka laboratory, paunsa ba sila mag-release og result? Kompleto ba tanan? Wala ba'y nakaligtaan na test? Reporting timeliness rate, kung moingon ka sa pasyente na, ma'am, balik after 1 hour. Pag mo balik na siya after 1 hour, tinuod yun na anak kay ma-release na result sa iya. No excuses na, ay ma'am, guba among machine, or unsa ba ma'am, na-delay ang processing, or all. So, yan, timeliness, pas-pas mo release o result. And then, we also have quantitative indicators for monitoring family planning and immunization integration. So, input. Okay, dito muna tayo sa input. So, when we say input, it's all about resources. Okay? You are going to provide or give something. So, we have here vaccine stockouts, contraceptive stockouts, diba? Service providers. No, it's all about services. And isa-isa din po dyan, merong purpose. Bakit ito? No, bakit natin monitor. Meron din pong number of service delivery, number of days per month when both immunization and family planning services are offered at the same time, and number percent of women attending routine child immunization purposes. So, purpose of monitoring, yan, naka-table na yan siya lahat, guys. Meron din po tayong outputs, okay? Kung sasabihin natin outputs, it's all about given out or ano yung na-produce natin. Okay? Again, balik tayo ha. Kung magsabi tayo ng input, no, ikaw mismo, no, to provide or give something. Okay, so inputs, it's all about the resources, human resources or material resources. Output naman, it's all about what is given out or being produced. So, dito na po papasok yung mga service delivery or services. Yan, mga keywords yan. Ito pa, family planning provider, routine child immunization services, routine immunization services, attending family planning services, and its purpose. Outcomes, these are the results. Okay? Results. So, we have here number of children receiving DTP1, immunization coverage, no? Again, no, ang under sa outcomes, yung result, no, prevalence rate, 'di ba? When we say prevalence rate, old cases plus new cases, di ba? Total financial cost of input required to integrate FP or family planning and immunization services. So, isa-isa din po. Yan, meron siyang purpose. And lastly, we have here the impact. So, when we say impact, this is the effect or influence. We have the indicator here, maternal, infant, and child mortality rate. Data source, the studies from maternal and infant mortality rate. And purpose, measure improvement in health status. Okay, so your HMIS indicators and health programs. What now? No, so what now is the relationship of these? No, your indicators and health programs. So your HMIS is a source of routine data necessary for monitoring different aspects of various health programs implemented in a country. So, each indicator must be carefully selected to, number one, meet the essential information necessary for monitoring the performance of health programs. Number two, present an overview of available health resources. Okay, first indicator, maternal survival. So, number one, diba, maternal survival, pagtuunan nila na og pansin, no, kasi tawag gina-focus na nila. Kasi nga, one of the indicator of a population kung healthy na siya is the maternal survival rate. Okay, so kung mga anak na lang gani, mamatay pa, diba? Unsa na gyud di ay ka-poor ang inyong health system daraan. So, number one, pregnancy care interventions. First, antenatal care attendances. Again, antenatal care that is given to pregnant women before giving birth when they visit the doctor's clinic. So, this includes check-up, monitor baby's heartbeat, take blood test for mother, no, like blood test if may gestational diabetes ba ang mama, yan. Fourth, antenatal care attendances. Cases of abnormal pregnancies attended at OPD of health facilities. Institutional cases of maternal morbidity and mortality due to antepartum hemorrhage. Okay? Antepartum occurring not long before childbirth. So, in Latin word, it is to bring forth. Okay? It is to bring forth. So, habang before, kasi nga, pregnancy, no? Before pa sila nanganak. Next naman, we have hypertension and edema. So, usually kasi, ni sila kanang nag-manifest, no, sa mga buntis. Cases of abortion attended at health facilities. Abortion. So, dili pasabot na abortion. Ay, illegal na rin ang abortion. Dili. Abortion, kung kag habitual abortion, dili pasabot ana perminti siya nagapakuha. Okay? Habitual abortion, it means na always siya makuhaan. Maybe because na ay problem sa iyahang reproductive health. So, cases of abortion, unsa na kanang gituyo og kuha, maybe because complicated na kayo yung pregnancy and mabutang sa danger ang life sa mama, for example. Okay, so perfect example for that, ectopic pregnancy. All right, cases of medical safe abortions conducted at health facilities. So again, it's all about maternal survival. Pangalawa, intrapartum. So intra, within. So kung kag within, habang nagapanganak. Okay, so this is all about delivery, no, pagpanganak. by skilled attendants at health facilities, deliveries by health extension workers, and institutional cases of maternal morbidity and mortality due to obstructed labor. Okay? So, obstructed labor, no? Masabta naman siguro siya. So, ang mahitabuan na, even though the uterus is contracting normally, no, the baby does not exit the pelvis during childbirth. Okay? Maybe because, no, due to being physically blocked. So, ang complications niyan, no, ang complications na pwede mangyari for the baby. So, ang baby dili siya makakuha og enough oxygen, no, which may result to death. Okay, next naman, postpartum or after manganak. So, first, postnatal care attendants, kasi nga, 'di ba? Usually, no, naatay ginatawag na postpartum depression. Okay? Institutional cases of maternal morbidity and mortality due to postpartum hemorrhage. Okay? And puerperal sepsis. So, puerperal, immediately, this is a period immediately following childbirth. Sepsis na ay microorganism dito sa blood, di ba? So, kung na ay microorganism, bacteria, for example, dito sa blood, o kung imuhang blood, asa man din napaingon to the different organs, no, different tissues of your body. So, kung ma-infect na, no, ang imuhang organs and tissues, syempre mag-malfunction, no, it will eventually lead to shock and death. Yan. So, dagan kayo complications, no? From the time na wala pa ka nanganak, hantod nanganak ka, maskin pa after manganak. Okay. Lastly, we have here the interpartum period. So, interpartum period, it means between childbirth. Between childbirths. So, parang may gap. Morning diri na mosulod ang family planning method, no? And family planning methods issued by type of method. Unsa ba na siya di ba lahi man gyud ang contraceptives. So, depende na lang na sa isa ka family kung unsa ang ilahang i-accept na method. Next naman, we have the child mortality and child survival interventions. Kasi nga po, yung pneumonia, that is the leading cause of death for children less than 5 years of age, according to the Department of Health in 2012. Ito, pneumonia. Okay? So, there are also DOH strategies or matawag na to sila na health programs, no, for good health of Filipino children by 2025. Number 1, Child 21, aka Philippine National Strategic Framework for Plan Development for Children 2000 to 2025. So, Child 21 is a legacy to Filipinos or to the Filipino children in the 21st century. Again, Child 21 is a legacy to the Filipino children in the 21st century. So, Philippines, in short, is a very cooperative country because in the United Nations Convention on the Rights of the Child, or it is commonly abbreviated as UNCRC or CRC, it is a human right treaty, okay, which sets out the civil, political, economic, social, health, and cultural rights of the children. So, nations that ratify this convention are bound to it by international law. Alright, next. Children's Health 2025. This is a sub-document of Child 21. So, it focuses on the development of Filipino children and the protection of their rights by utilizing the life cycle approach. So, a life cycle approach can help us make choices. No? It implies that everyone in the whole chain of a product's life cycle, no, from cradle to grave, okay, they have a responsibility and role to play, taking into account all the relevant impacts on the economy, environment, and the society. Number 3, we have the integrated management of childhood illness, or the IMCI. This is a strategy that aims to lower child mortality caused by common illnesses. Diba? Kung isipon mo common illnesses, flu, cough, no, diarrhea, fever, simple naman na siya ng mga sakit. Tapos mamatay pa gyud ang bata, diba? So unsa na gyud di ay ka kanang lisod inyong country nga dili man gyud na ninyo siya matabangan. So mao nang no naay gihimo na health program ang DOH. Okay? So again, it focuses on decreasing the child mortality, dili mamatay itong mga bata na usually common illness lang. Number 4, enhance child growth. It is an intervention aimed to improve the health and nutrition of Filipino children. Maunang na ay mga feeding program, di ba? Kung ma-remember ninyo sa inyong mga school sa una, no, na ay mag-adto ng mga tao, and then kalit lang sila maghatag og food. So, feeding program. We also have the STP, or Stop TB program. So the goal is to dramatically reduce the global burden of tuberculosis by 2015 in line with WHO MDG, or Millennium Development Goals. So not to be confused with WHO 17 developmental goals. Lahi tong SDG, lahi po ni ato ang MDGs. So the main objective of the program is to achieve universal access to high quality care for all people with tuberculosis, including those co-infected with HIV and those with drug resistance. Kasi po, common po kasi na if may TB ka, common but not all ha, if may TB ka, positive dako ang chance na baka positive ka din sa HIV. Or pwede din po, first na detect is HIV, positive ka, mo nang i-refer ka magpa-test, 'di ba? Kay basin positive po ka sa TB. Okay? Kasi nga ang TB mo tama na siya if low imuhang immune system, which is mao man gyud ang mechanism sa inyong HIV. Okay? So mo na ipababa or mag-weaken ang inyong immune system. So these are your SDGs. So dili ni siya mao ato ang ginapasabot diri ang MDGs. Ito 8 lang ni sila kabuok, no, Millennium Development Goals. Okay, so dili na nako isa-isahon og basa, no, kay mabasahan kabalo na mo mubasaan na. All right. So we have the core, no, of this program. So dapat may TB case detection, dapat ma-detect talaga, no, na okay kanina isa ka tao pag magpa-test siya makita gyud na naa siya TB, no, dili siya makaligtaan, plus successful completion of the treatment and eventually ma-cure ang TB. Okay, thus by 2050 kung na-detect na ay TB ang isa ka tao, no, ma-complete niya ang iyang treatment and maulian siya, then it will reduce the prevalence and death due to TB by 50% compared with the 1990 na baseline. Okay, so murag taas kay ni na study no from 1990 up until 2050 nga ilahang goal. So HMIS indicator, stop TB program. So TB patients on dots, okay, mo na ginatawag na mo na TB dots, meaning anang dots is directly observed treatment short course. So number of new smear positive pulmonary TB cases enrolled in the cohort, diba? Cohort, that is a group of people banded together as a group. So kumayon ka cohort, parang isa siya ka grupo sa mga subjects that share a common characteristic. So kung masali ka dito na cohort, imuhang mga kauban na subject na agad mo yung similarities or you share common characteristic with each other. TB case detection, this is a number of new smear positive pulmonary TB case detected, number of new smear negative pulmonary TB cases detected. So dapat sure yun na smear negative yun na siya, no? And number of new extra pulmonary TB cases detected. Kasi kung falsely negative na siya, no, di gahapon ma-detect, di ba? Falsely negative. Kung ka falsely negative, nag-release kag result na negative, which is dapat positive to siya. So kung wala na detect na siya TB, o di gyapon siya matambalan. So makatakod na po na siya dito og lain na mga tao. So ito na explain ko na to, no, HIV TB co-infection. No, murag duha, naging duha na yang sakit na siya HIV na po siya TB. HIV positive new TB patients enrolled in dots. Mo na sa una, no, kanang ako as HIV proficient, pag naay HIV positive, no, kay ako man gid ang makabaloan na sa result na naay HIV positive sa kapasyente, need yun ako na siya i-refer, no, katong gina-referan ako nurse to, siya ang head sa TB dots program, kay para ma-enroll siya dito no, TB dots program. Okay, and the TB treatment outcome. So yung treatment ba niya na complete, okay? Treatment completed in pulmonary tuberculosis. Na-cure ba siya? Defaulted PTB and deaths caused by pulmonary tuberculosis. So, what have we learned so far? Ito. Alright. So, that would be all, no, for our second lesson. I hope you learned something today and see you next meeting. Announcements, I'll just send sa GC, no, para dali ra ninyo siya ma-review ang announcement from time to time if you want to check it again. Okay? So thank you so much everyone. Goodbye.